Hi, my name is Eva Grazel. I am a stage 4 survivor of oral cancer. Ironic for a storyteller. It all started when I developed a sore on the left side of my tongue, an unusual place for what seemed to me like an ordinary canker sore. After about 8 weeks, I went to a local oral surgeon. He examined it. I complained of the pain. He said, if it bothers you so much, we can take it off. And I said, great, just take it off. 2 days later, I was fine. 2 weeks later, I get a phone call from his receptionist. She told me my biopsy was negative. I said to her, are you calling the right patient? She said, did you have tissue removed from your tongue 2 weeks ago? I said, yes, that was me, but I didn't know it was being biopsied. I literally thought, what on earth could they be looking for in a biopsy of the tongue? She said, oh, you have nothing to worry about. I said, great. I didn't even know I needed to worry. I was unaware my biopsy was read by a general pathologist who misread it. I know this because 2 years later, when I'm finally diagnosed, the head and neck pathologist at Mount Sinai Hospital asked to see the original biopsy. And she said, sorry to tell you this, Eva, but you should have been flagged 2.5 years ago. This was not hyperkeratosis. It was moderate dysplasia back then. So the story goes that I had no symptoms for 2 years after that biopsy. But early stage oral cancer is often asymptomatic. You don't feel it. But the tissue is changing. The color and the texture was changing, but I didn't know to look. Then the sore comes back right over the biopsy site. I go back to that oral surgeon about 8 weeks later. He looks at the old biopsy report. He said, Eva, this is caused by trauma. Use saltwater rinses or a gel for the pain, and if it doesn't improve, come back. I followed doctor's orders. After 8 weeks, I go back. He said, Eva, your molars are sharp. Go to your dentist, have them shaved down. That should do the trick. And if it doesn't improve, come back. I go to the dentist, they shave my molars down. They reminded me if it didn't improve to return to the oral surgeon. I thought it was improving. There were days it didn't hurt quite as much. There were days when the white center of the lesion didn't seem quite as big. After another 8 weeks, I go back to the oral surgeon, this time requesting to see a different surgeon in the practice. He looked at the records and he said, Eva, you must be gnawing on your tongue when you're unaware of it, like at night. I defended myself. I'm like, doctor, I do not bite on my tongue. If I gnawed on my tongue, I'd literally go through the roof in pain. He said, look, I'd like you to go to the dentist, have a night guard made to protect your tongue from your teeth. This is caused by trauma. If it doesn't improve, come back. I go to the dentist. It took 2 weeks to get the impression. I wore this night guard 24/7 except when eating. I needed to believe I was doing everything to get this ulcer on my tongue to just heal up and go away. Then I get this excruciating earache, only on this side. I go to my GP. He says, Eva, you have water on your eardrum. Prescribes 10 days on antibiotics. I said, doctor, I got this weird thing on my tongue. When my tongue hurts, my ear throbs. He said, let's see. He looked inside. He goes, whoa, have you seen an oral surgeon? I said, yes, I've seen 2 oral surgeons and 2 dentists. He said, good. They'll know what that is. Let me take care of the water on your eardrum. After 10 days on antibiotics, the earaches did not go away. Why? Because the tumor was so big now, it was sitting on a nerve to my ear. I go back to that oral surgeon demanding answers. I said, I can't live like this anymore. What are we going to do? The oral surgeon said, your tongue is small. We don't want to cut it up unless we have to. But at this point, I would suggest another biopsy. Sure, I agreed. I scheduled a biopsy for a week later, and I started to think on my drive home, maybe I should look elsewhere for answers. I ended up going to Mount Sinai Hospital in New York City for a second opinion. That doctor looked at me. He said, "Who are you here with?" I didn't even know I needed to bring anybody. I didn't know that what was on my tongue was remotely serious. He said, "We're going to do a minimally invasive biopsy. It's protocol to have someone with you." When I woke up, my mom was squeezing my hand. Dr. Erkin looked directly in my eyes and he said, "You have a squamous cell carcinoma on the lateral border of your tongue." Woozy from anesthesia, I said, "Is it benign?" In an apologetic tone, he said, "Eva, you are in an advanced stage of oral cancer." I never heard those words. I never knew you could get cancer in the mouth. If I had been educated, I know I would have been more proactive. I would not have let this go on for so long. Whose responsibility is it to educate patients about this disease? If dental professionals aren't educating patients, who is? Patients need to know not only what a screening is, what it entails, but what you're looking for. To this day, I don't know why they kept saying to me, "If it doesn't improve, come back." In essence, they were asking me to self-diagnose myself. They should have said, "If this doesn't resolve in 14 days, we want you back." So, my advice, in a nutshell, is make sure that every dental practice has a camera. You can't possibly remember what something looks like in the mouth in a suspicious lesion unless you took a photo of it. Use a probe in the photo so you remember the size and the location. I say SNAP, and maybe this will help you remember that the S stands for say the words oral cancer. The N stands for never say if it doesn't improve, come back. The A, always follow up. If patients say, "I'm so mad at you, you made me get this biopsy and it was nothing," you can say, "It wasn't nothing, it was suspicious." And actually, from this day forward, we need to partner with each other. You need to watch that area carefully for any changes at all in texture or color. Because if you notice change, you need to come back immediately, even if it doesn't hurt. And then the P in SNAP stands for pathologist. If your patient continues to complain about something in your mouth, and they had a biopsy and it was nothing, negative, well, have that biopsy reread by an oral pathologist. In fact, why isn't it that every biopsy from the mouth goes to a specialist? Well, I hope that you take away from my mini presentation today about the role that hygienists play in catching this disease in its early stages. We survivors are not asking you to prevent it. You can't do that. But if you catch it early, it's very survivable. I'm one of the lucky few. I've had a third of my tongue reconstructed, a radical neck dissection. Tissue from my forearm was used to replace the outside of my tongue. An artery was taken from my arm to feed blood to the graft site. I've had 40 lymph nodes removed from my neck, 3 of which were cancerous, which puts me at stage 4. But I'm articulate because they left the tip of my tongue intact. It's an extraordinary surgery. And the radiation, Whew. Well, that's a story for another time. There's a lot to learn from that as well. Not just about what oral cancer treatment is like, but how you can make a difference and how important it is for dental professionals to really partner with patients during the process of treatment so they don't feel so alone like I did. I thank you from the bottom of my heart for being proactive, educating patients, raising awareness, and saving lives. Thank you.